Today we will be taking up the clinical cases which you are expecting in your NEET PG and FMGE examinations. So I will be discussing some of the important cases, how they arrive at the answers, and what the options are, and how we just separate the options and arrive at the proper clinical diagnosis and the correct answer. So as far as these clinical cases are concerned, NEET PG and FMGE will be just discussing these things in detail. So as you can see over here, let's move to the first question. And this is an image-based question. The question reads, the figure shows blood vessels supplying the descending colon and the sigmoid colon. So over here, there's a blood vessel which supplies the descending colon and the sigmoid colon. The most likely vessel is, and the options mentioned are celiac trunk, superior mesenteric artery, inferior mesenteric artery, and the external iliac artery. So as far as this question is concerned, this is a question which has an embryological basis because we know the primitive aorta and the three branches of the primitive aorta, the ventral branches of the aorta, the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. And all these three vessels in an orderly manner are the branches or the derivatives of foregut, midgut, and hindgut. So celiac trunk is a vessel supplying the foregut. The superior mesenteric artery is the vessel which supplies the midgut, and inferior mesenteric artery is the vessel which supplies the hindgut. And as far as descending colon and sigmoid colon are concerned, they are the derivatives of the hindgut. So the inferior mesenteric artery would be the vessel supplying the descending colon and the sigmoid colon. And as far as the arterial distribution of the inferior mesenteric artery is concerned, we're well aware that it supplies from the left 1/3 of the transverse colon, the descending colon, the sigmoid colon, the rectum, and the anal canal. So that is how we just arrive at the diagnosis, at the correct answer, and this is how the clinical cases are mentioned. And you are given such types of questions in your NEET PG and FMG examinations. Now, an anatomist asks his students appearing in aims for INICET or INCT to identify the area below. The vessel denoted by the arrow is. So over here, there is this vessel and there is the arrow, and we are given options: circumflex artery, right marginal artery, anterior descending artery, and the posterior circumflex artery. So as you are well aware of the anterior interventricular groove, and in that lies the anterior descending artery, and this anterior descending artery is a branch of the left coronary artery, a very important vessel. So image-based question, you are just asked to identify the vessel running in this groove. So the vessel is the left anterior descending artery, which is a branch of the left coronary artery. And as far as the functional significance of this left anterior descending artery is concerned, we know that it is also given the name as widow's artery, and one of the common vessels to get blocked and can cause a massive MI because it supplies a large portion of left ventricle especially. And so this is the identification and image-based question which is asked in the NEET PG and FMG examinations. Now, a question from microanatomy. A NEET aspirant is asked by his anatomy teacher, who teaches them embryology, to have a look at the image below. The below shows histopathological slide off. So you can see, just have, I will not go into the options. There's something called as cortex, something called as medulla, and there are shown the Hassel's corpuscles. So the options mentioned are tonsil, ovary, thymus, prostate. As far as ovary is concerned, we have the germinal follicles over there of various stages. In the prostate, we have something else. In the thymus, we are aware of the Hassel's corpus. Tonsils are characterized by crypts, and we do not see any crypts over here. Thymus is a very important, entity, and you have to remember that the thymus histologically has got lobes, lobules, and outer cortex and inner medulla. And in this, we have those aggregates which we give the name as Hassel's corpuscles, which represent the remnants or calcified structures, sometimes having a cut cabbage appearance. And you have to remember these entities. Hassel's corpuscles are a characteristic feature of thymus. In a manner, we have got certain bodies, certain important elements like the crypts in case of tonsils, like the germinal follicles in case of ovary, like the corpora arenaceae in case of pineal, and so many things which are histologically important. So you have to remember these bodies, the characteristic microscopic features of certain organs, certain viscera, and certain important entities which are there anatomically. Now, this is a question, clinical based question from, say, you can say pathology. A 73-year-old male presented to the orthopedic clinic with bone pain in the right hip region. After getting a radiograph, a 3.5 centimeter lesion was seen. The histopathological slide shows destruction of the bone with abundant osteoclast. The diagnosis is that of a giant cell tumor. The pathologist should report it as. Now, in here the examiner is giving you the diagnosis, giant cell tumor, and you have to just say which is the correct option: Ewing sarcoma, osteoclastoma, osteoidostoma, osteosarcoma. So the slide is there. It shows, I mean, say, destruction of bone with abundant osteoclasts. And you have to remember that the synonymous name of giant cell tumor is the osteoclastoma. So this question tests your ability to know the different names of the same entity. So giant cell tumor or osteoclastoma is one and the same thing. And as far as GCT is concerned, it's an epiphyseal tumor which arises from the, I mean, say, giant cells are characteristic, and there's a characteristic sore bubble appearance. And histopathology shows destruction of the bone with abundant osteoclasts, and that is very important. So, what this question tests your ability to know the different names of the same condition. So, you have to remember that GCT or giant cell tumor is also called as osteoclastoma. Very, very important. Now, this is another clinical question. An 18-year-old girl presents to the orthopedic clinic with complaints of local pain and swelling in the right femur. There is fever, leukocytosis, and increased ESR. The radiographic appearance shows a large diaphyseal tumor with periosteal elevation. The tumor is positive for glycogen or PAS. The most likely cause is sarcoma, osteoidostoma, chondrosarcoma, chondroma. Now, as far as this clinical condition is concerned, a young girl presenting with something like inflammatory swelling in the right femur, and there is associated fever and leukocytosis and increased ESR, it would just simulate something like osteomyelitis of the bone, but we do not find osteomyelitis as an option over here. It looks as an inflammatory condition. And one thing you have to remember, that there is this peculiar bone tumor, the Ewing sarcoma. Ewing sarcoma is a diaphyseal tumor, and you have to remember it simulates osteomyelitis. So patients can present with features like osteomyelitis in case of Ewing sarcoma, fever, leukocytosis, but important is PAS positivity and periosteal elevation and diaphyseal tumor. So these three things are big clues pointing towards the diagnosis of Ewing sarcoma. And here the examiner has been quite, I would say, a bit rough, not in giving you the exact option, Ewing sarcoma, but he is telling you sarcoma. And this is not chondrosarcoma, this is Ewing sarcoma, and that is why this question becomes a bit of a moderate, difficult question. So remember that Ewing sarcoma is the correct answer. This is a classic clinical example of trying to distract you, but understanding, and the examiner wants to test whether the distractions will distract you or not. So here a good student, academically good student, will answer this question very nicely, and he will have no confusion as far as the correct answer is concerned. Now, from pediatrics, or neonatology, a 4-year-old neonat is presented with pustular lesions or with on erythematous background, starting from the trunk, noted from second day of his life onwards. Otherwise, the baby appears normal. What is the most likely diagnosis? Mongol spot, erythema toxicum, pustular melanosis, neonatal acne. Now, very important question. You have to remember that there are certain things which are misnomers. Say, for example, if the answer to this question is erythema toxicum neonatorum, a big term, and you get frightened, and toxicum, erythema neonatorum, and basically this erythema toxicum neonatorum is misnomer, because the child is not toxic, and this is a, I mean to say, not that rare an entity, and the neonates usually present with pustular lesions with erythematous background, and it is completely almost a benign condition which appears within first few days of birth, and this might go off its own as well without any active intervention. Neonatal acne is not presenting like this. The Mongolian spots are something different. They are congenitally present and they too are benign. They have nothing to do with Down syndrome. So the correct answer over here is erythema toxicum or erythema toxicum neonatorum, as is in the answer line to be more specific. Now, a malnourished children has been diagnosed with acrodermatitis entropathica. It is a result of the deficiency of which mineral? Copper, magnesium, manganese, and zinc. So, as far as this is a simple question, you know that the low zinc levels, low serum zinc levels can cause a condition called as acrodermatitis entropathica, and it is due to zinc mal absorption. And these children usually present with alopecia, a rash, vesicular, pustular crusting with scaling and erythema, just like scabies with hypopigmentation of the skin. And these children usually have got chronic diarrhea. Over a long period of time, a chronic zinc deficiency can cause chronic diarrhea and then get steatoria as well. So zinc is a very important, element which is given in many of the compositions these days to the pediatric age group, so that many of the patients who have got classic acrodermatitis entropathica with low serum zinc levels are supplemented by zinc supplementation. So you have to remember the importance of zinc as a element and its deficiency. Now, this is a similar question. A child has multiple itchy papular lesions on the genitalia and fingers. Similar lesions are seen in the younger brother. All except following is the possible diagnosis. So, which is important is that you have to remember the question should read at which is the correct diagnosis. So as far as this question is concerned, this is a classical case of scabies, and patients with scabies have got intense itching, burrows, the interdigital areas are affected usually. There are papules, vesicles, and eczematous plaques and pustules which will be seen. An important condition is that it is usually seen in nurseries, it is usually seen in crowded areas, it is usually seen in hostels, it is usually seen in, closely congested areas with underprivileged societies more common who do not maintain a proper hygiene. A diagnosis of scabies is considered in patients with pruritic lesions, especially nocturnal prurites, and the lesions are distributed all over the body. So scabies is the correct answer, as scabies is present in a manner as is given in the question. Now, this is another question from pediatrics. A young child develops episodes of hypoglycemia. The von Gerek's disease is diagnosed and it is due to. So here the question examiner questions your ability to know the enzyme deficiency, whether it is liver phosphorylase, muscle phosphorylase, lysosomal alpha 1 4 glucosidase deficiency, or G6PD. So as far as the G6PD deficiency is concerned, you are well aware that it is an important entity, and patients or children usually present with, abdominal distension, a protruded abdomen because of hepatomegaly. They have got hypertrophied muscles. There is truncal obesity and doll-like facies. And the enzyme which is deficient is the G6PD, glucose 6 phosphatase activity is deficient. So you have to remember these, entities like von Gerek's disease, Pompey's, Corey's, McArdle's, Anderson's, Haar, Story's, Hunter, Shy's, so many syndromic entities, the enzyme deficiency is present, and what substance gets accumulated there. So these are very important questions, and this is a simpler sort of a question which has been asked in NEET and FMGE many a times. Now, this is an image-based question. A child presents with sudden onset difficulty in breathing. X-ray is done and it is shown, and most likely causes asthma, bronchiolitis, foreign body diaphragmatic hernia. So the ability to arrive at the diagnosis, you see this is the vertebral column, and in here you see something like a artifact or something like a coin-like structure in here. So this is something, I think, because it's a sudden onset difficulty in breathing, and there are very few causes of sudden onset. Why should a child have a sudden onset difficulty? The child has ingested something taken and it has wrongly landed into the respiratory passages, and you can see a foreign body over here. This is a well demarcated foreign body, a coin which is lodged, and you can see in the chest radiograph that this is a coin, and you have to remember these to identify these things. So this is a question simply testing your ability to arrive at a diagnosis. what it is. So this is a foreign body over here. In addition to that, you may given a chest radiograph asked about the right border of the heart, the left border of the heart, what is aortic knuckle, what is pulmonary conus, what is the left ventricle, what is the apex of the heart, so what are the cardiophrenic and the costophrenic angles, and where is the trachea, and so many things about the chest radiography. But this tests your ability to arrive at the conclusion of the answer as a foreign body, which is shown by the marker over here. Now, another question radiographic from radiology, from the examination of the radiographic below, the most likely condition is, so you the cannonball metastasis, nephrolitis, hydroureter, renal trauma. So basically over here, a student should be able to identify the pathology once again. So you can see multiple calculus scattered in both the renal areas. So this is the renal area, this is the ureter, and this is the termination of the two ureters in the urinary bladder. So over here you can see the renal calculi. Well, bilateral nephrolithiasis is a clinical condition commonly encountered, and renal stones, gallstones are very common entities. You have to remember about the nephrolithiasis as well as cholelithiasis. But over here, this image, radiographic image of nephrolithiasis, simple ability to arrive at the diagnosis. Now, from a social and preventive medicine, the Aedes mosquito is shown below. It is implicated in which disease? So this is a classical Aedes mosquito, Kala Azar, Japanese Encephalitis, filariasis, dengue. So as far as you are concerned about the causative organisms, you know dengue is caused by Aedes aegypti, and filariasis is caused by Culex, Japanese Encephalitis by Culex, another species, Kala Azar by sandfly, phlebotomus, and malaria by female Anopheles. So this ability to recognize this, different, types of mosquitoes, different types of flies, lice, which are important entities as far as social and preventive medicine are concerned. Now, in addition to that, key image pointers, you have also in the social and preventive medicine. I've given a brief clue of just these, symbolic entities, the various programs, their, conventional symbols, and how they look. Key image pointers like the National Leprosy Eradication Program. How does the logo of that stand for? National Tuberculosis Program, National Program for Control of Blindness, and all those things. So this is just by the way to give you an idea how the questions are asked. Now, this question, a 45-year-old male, clinical question with hyperuricemia, has a scaly rash on arms and knees, and it has been there for years together. It actually has deformed phalanges. Most likely diagnosis is juvenile rheumatoid arthritis, ankylosing spondylitis, osteoarthritis. Sorry, 45. Juvenile would be out of question. Ankylosing spondylitis can be considered as a possibility. Osteoarthritis a possibility, but there is hyperuricemia, and you know that there is a scaly rash, and there is the deformed phalanges. This is classical psoriatic arthritis because psoriasis presents with hyperuricemia usually, and presence with a scaly rash, which is usually on the extensor aspect of the limbs. So psoriatic arthropathy presents with deformed phalanges. So there are so many clues which you have to arrive. Just two-line sentence, and the examiner has given you a clue in the form of hyperuricemia, in the form of a scaly rash and deformed phalanges. So that is how psoriatic arthritis presents. Severe pons present with arthritis mutilans, a severely deforming entity. But you have to remember that phalanges are deformed here, and there is this, arthritis mutilans, which you have to remember because the fingers and toes can get severely deformed, and due to erosion and instability of the interphalangeal joints can occur. So this is a classical example of psoriatic arthritis. Now, in addition to that, you have to, why I'm giving you some things, so you have to, somewhere you are asked to identify the lesions on the radiograph. So over here, you can see the shoulder joint. This is the humerus. This is the head of the humerus. Here is the glenoid cavity. So you can see that it has moved around, and this is the dislocation of the shoulder. And over here, you can see there's a big breach in the humerus. This is the fracture of the humerus, very well demarcated. So my point of this lecture is to make you acquainted what are the various types of questions which are asked. These questions which I have revised are very important. You are asked such types of questions in your examinations. That is why I just wanted to give the NEET PG and FMGE students a brief idea before their examinations, what you expect, how you expect, what are the types of questions you expect, and how to answer them. So I think that this might benefit you a long way, and I wish you success for your examinations and best of luck. Thanks a lot for your time and your attention. I wish you best of luck again for your exams.